Hi, my name is Dr. Paul Feuerstadt, and I'm really delighted to be participating in the C. diff Foundation's annual walk for C. difficile awareness. What I'm going to be talking about today is a general overview of the pathophysiology of C. difficile and how it infects us. It's important that we remember that C. difficile is a bacteria, and that bacteria is rod-shaped. And there are two main phases of C. difficile infection: the spore phase and the vegetative phase. As a patient, the vegetative phase is the phase that we most often think about when we think about C. difficile, because the vegetative phase releases small things, small proteins that cause changes in our bowels, specifically abdominal pain as well as diarrhea. Classically, the vegetative phase is susceptible to gastric acid and susceptible to alcohol-based hand sanitizers, things like Purell, meaning when the vegetative phase comes in contact with these things, it gets wiped out. Alternatively, the spore phase is a much more resistant phase. The spore phase is resistant to gastric acid and resistant to alcohol-based hand sanitizers. And this is why C. difficile spreads, because the spore phase can be swallowed, and when it gets swallowed, it goes into our intestine, it passes our stomach because it's able to survive the acid, and once it gets into our small bowel, it's able to convert from the spore phase to the vegetative phase, a process called germination. When that germination happens, the vegetative phase multiplies, divides, and multiplies some more as it builds an army of sorts as it heads towards the colon. But I'm a gastroenterologist, and I think the colon is a brilliant organ. And the colon is a brilliant organ because the colon has its own defense system, independent of the blood-borne defense system, that protects it. What is that defense system? Something called colonization resistance. What classically weakens colonization resistance? Antibiotics. The antibiotics that classically weaken colonization resistance include amoxicillin, ampicillin, clarithromycin, fluoroquinolones, and cephalosporins. We alter the microbiome, or the bacteria in our gut, and by doing that, we create an environment that's more welcoming for the C. difficile to proliferate, and the C. difficile ultimately does proliferate. It grows, and when it grows, it releases those toxins and causes those changes to our bowel that cause abdominal pain and diarrhea. As we all participate and as we all understand C. difficile better, it will help clinicians and patients in the long term minimize the effects of C. difficile, minimize the incidence of C. difficile, and hopefully improve outcomes.